us at the Caribbean General Hospital. It is indeed a great pleasure to have the members of the media here present to have a discussion and then a way forward for mental health advocacy. You know, the media fraternity is very key here, as you are the mediators between us and the public. So it is important that we get the right message from the right people so that the public can be sensitized on mental health. On the high table here, I have far on my right, Mr. Mahmoud Jassi, who is a senior program, mental health program manager at the office here. And of course, we have the mental health program manager, that is Ms. Manjara, and I myself, Bakari Kamara, the matron of Tanga Psychiatric Hospital, and of course, one of our colleagues here who has worked for mental health for a very long period of time, and he is no other person than Kachim. Okay, so it's going to be a very long training wherein we will be sensitized on mental health. We get to know what is mental health, what are the factors responsible, the management, how to address stigma and discriminations, the challenges we have, and then of course, some recommendations that will be given to anyone that is willing to support. And this is why we are here today. So mental health is something that we all know about, and it is something that is a burning issue in this country. We've had, very serious cases against people that are mentally challenged. Whether it is true or not, we are all, living to witness the things that are happening. And it's like it's something going on. You hear this today, in few months' time, you hear another event happening. And then some of the cases are even murder cases. So this is why it is a serious issue. And not only that, we also know about the drug issues that are happening in the country right now. In fact, we are told there is a report that some of the youths are dying. But we don't know actually what is responsible, but there is a speculation that it is as a result of the common foods being consumed here. So these are some of the things that the country is challenged with, and then the mental health program itself also has a role, because it is a mental health program. It's not only talking about psychiatric condition, but of course addiction, and we know like drugs usage is one of the risk factors of you having psychiatric condition. So this is why it's a burden on all of us, especially the mental health program unit here. So on that note, I thank you once again for coming or gracing this opportunity, or honoring the invitation. Because as I said earlier, we count on you to teach the public or convey the message that is given to you guys. So the program that goes like this. From this opening remarks, we will have the prayers, we introduce ourselves, and possibly we'll have the breakfast at that time. And from there, we will have a short presentation from the matron of Tanga, and of course the program manager. And we are expecting Mohamed Gassama from WHO, who should also present. So either he comes or not, that presentation will happen. So we expect 3 presentations here. On that note, I thank you so much once again, and I will leave the program manager to say a few words in case she has something to share. Thank you so much once again.
Good morning once again. Manjara Marega. I'm the program manager for the National Mental Program. I'm also a psychiatric mental health nurse. Thank you so much for gracing this occasion. This is really, really important. I call you guys our colleagues in the fight against reducing the burden of mental health conditions or problems in the country. You, the media personnel, you are the voice of the voiceless. And this includes people living with mental health conditions. We are their carers. We understand their emotions. We understand their perceptions. And this makes us colleagues in helping them. And then again, we are all in this challenging but yet it's fulfilling journey. Now, mental health conditions are everywhere. The burden is across all countries in the group. And it's a basic human right. It's one of the essential basic human rights. And regardless of age, gender, socioeconomic status, religious affiliation, sexual orientation, etc. People, whether you live in the community or you're a patient in Tanka, or you're a professional, a journalist, a mental health practitioner, it doesn't matter. We all deserve the highest attainable mental health. We all do. However, this is still a challenge globally. And people living in mental health conditions have been experiencing a wide range of human rights violations, including stigma, discrimination. The statistics are high, and we will later discuss some of this, but I would like to just brief. Now, it's important that we know mental health conditions are the leading cause of disability globally. They are the leading cause of disability. And these disabilities are caused by common mental health problems, such as depression, anxiety. Now, WHO defines common mental health problems as those problems or mental health conditions that affect more people than the rest of the conditions. So these are, for example, depression and anxiety. But sometimes some of these disabilities are caused by chronic mental health problems, such as schizophrenia. I mean, I may not be able to explain that to you. For example, you see people walking down the street, unkempt, talking to themselves. Some of them have schizophrenia. It's a chronic mental health condition. But also dementia, which mostly affect the age, as well as substance abuse, which is the public health concern currently. My colleague has just mentioned that. Now, depression is one of the leading causes of mental disability globally, and suicide is the fourth leading cause of death among 15 to 29-year-olds. Now, WHO has stated that 1 in 4 people, how many of us are here? We are many, right? 1 in 4 people will experience a mental health condition. It could be once or twice in their lifetime. To further break this down, 1 in 3 women and 1 in 5 women will experience major depression. When we say major depression, because mental conditions have different categories and levels. We categorize them on a mild, moderate, and severe. So WHO is indicating that 1 in 3 women and 1 in 5 men will experience major depression. So that means it's more common in women. And women, we are part of the vulnerable group. We, the children, the elderly. And again, 1 in 7 children between the ages of 10 to 19 will experience a mental health condition. So all this is significant. Because looking at that age category is really, really critical. 10 to 19, the adolescent gap. And these are going to be people that are going to serve the nation tomorrow. So if we address the burden of mental health, and we're going to do it alone, our program under the Ministry of Health coordinates all the mental activities in the country. However, we cannot do it alone because we are resource constrained. The human capacity is very, very big. And that is why we call it here today to have a discussion. Like my colleague has said earlier, we're going to have a discussion. It's not going to be a whole long day for curriculum. It's not going to be a whole long day, right? But then we're going to have discussions on mental health. What is the office doing? Because we've been doing a lot, but sometimes not in the media, so people don't know what we are doing. But we're also going to not only talk about our achievements, we have our challenges. So all of that will be discussed later in the day. Thank you so much, and thank you for coming once again.
Okay, thank you very much, Ms. Mariana. And I would also invite the veteran of Tanka in case he has anything to say. Okay, and you see this one. Just one.
My name is being the only second hospital in where we employ mental individuals. When we talk about Takataka, some people take it in another way around. In fact, they ask a question here now by saying we know where Takataka is located. Most of all, we don't know where it is located. Talking of knowing the services for us, I think that's part. I think today in our introduction here, we will get to know the services we offer, what the challenges we go through, and what are the good work also we also do in that facility. So it is very, very crucial for individuals to at least play their role as an advocacy. When we talk about advocacy, mental health in general, it is a multi-sectoral approach. What I mean by multi-sectoral approach means not only mental health is gone beyond the mental health program unit only. It has gone beyond the mentally trained specialized individuals. So this is why I said it is a multi-sectoral approach, where we the place that are roles by doing the advocacy, doing the communications out there to reach the community. So sometimes when we are in the facilities, we always see them, but then the messages are filtered out to the mass group of the population, general population. So today we will interact and we will get to know more about the services we offer at Takataka, and then what are the way forwards for us to be doing or contributing towards everything, all the activities we have. What is killing us here in the country is the stigma and the discrimination attached to the mental health individuals. Even to the service givers, not only the service users, even the service providers are also being stigmatized and they are being discriminated. So this is why sometimes if you go to Takataka, some of you go to Takataka, this is why if you go to the hospital, you will not see the hospital other than the Takataka, apart from the only main highway. That is only where you see the Takataka. But if you come at the hospital gate, you will not see it everywhere, simply because some of the individuals when they are passing by, they say, people, carried off. So what does that mean? And then let me tell you this: even the mentally ill individuals, if you call them mad, they won't like it. They don't like it at all. You tell them mad, they will tell you, no, man, not mad. I am not mad. So why are you calling me mad? So most of the time, these are the words we will always want the mass media or the televisions or whatsoever communications we are using to be filtering out without, in a civilized way, without using those stigmatizing words. What our family members and our communities or the general populations are from using to these particular individuals. They are also human beings. They also have their fundamental human rights that we all need to respect. So, without wasting more time, when you go into the session proper, then you will get to know more, and then the services we are all rendered that are not being recognized at all. To say, because simply because it's going to know, then you will see the program units, what it will tell you. Then at my side also, I have a lot to say. Then we will discuss together. And when we are disseminating it, we disseminate it in a certain way that everybody will like, and everybody will, at least communications will be filtered out where the consumption in the higher populations will be there. So this is why you are all been invited here to at least, let me just say once again, thank you, and thank you for respecting or honoring the invitations here. Without wasting more time, we have in our midst, we have our mentor in the WHO. He has been working with the WHO for so long. So without wasting more time, I will share the baton to him. Thank you so much for the mass media.
Good morning, colleagues. When I say colleagues, media is very powerful for us because without you, I don't think we can send our messages properly across the population. So we thank you very much for coming. Of course, the World Health Organization has to also thank the Minister of Health. We are working with the Minister of Health in this, and don't be surprised. It's not the first time we have had this. Of course, We've not been having it regularly. But there is a reason why we bring you here. This is not the ordinary type of just type of press briefing or press conference, whatever. This is a different. We want to share the little we know about these conditions. We want you to be advocates for them. Don't come here and just run after my speech because I don't have any speech. So don't wait for that. What we are here for is to help ourselves, equip ourselves with the knowledge and skills that is required to do ABC in our own news, whatever, media outlets. And I'm very happy that our team is here. Whenever I see them around me, I'm very happy. The mental health team is vibrant, they are doing their best. But why are we calling you? Why? Please, that message is very clear. Why are we holding this meeting? I am sure a lot will be discussed later. But the world is what we call in a transformative mood for mental health. This is what is contained in the 2022 Global Report on Mental Health. There is a report that was launched quickly, not long ago. And how many of us have read that? So you see, this is also telling you that you need to equip yourself, not only waiting for experts to talk with you, but you also need to equip yourself, teach yourself, educate yourself on mental health. What are we? Why are we talking about mental health today? Because if you look at it, no matter what you are, whether you are a journalist, whether you are a minister, whether you are a president, whether you are a farmer, whether you are a cleaner, everybody is vulnerable to mental health conditions. Whether you are even a psychiatrist, we all know psychiatrists. If you don't know, those are the people who are specialized. Even they themselves are not vulnerable. And that's why we are getting doctors sick. Doctors are human beings also, although they are not, God has given them that knowledge to be able to prevent them. But that doesn't mean that doctors don't get sick. So it means that everybody, from top down, we are all vulnerable to mental health conditions. So what do we do? Then why do we joke with this? The world is joking. I will say the world is not doing sufficiently enough for mental health. Because as we speak now, 1 in every 8 person has a mental disorder. Which means 1 billion of the world population has a mental disorder or mental health condition. This is serious. One in every 8 person in the world has a mental health condition. So where are we? This is far more than the malaria we're talking about. Far more than, HIV/AIDS. Far more than tuberculosis. Far more than other conditions. But yet, those conditions are getting the resources they need. They may not get everything. But where is mental health now? 1 in every 8 person in the world has a mental health condition or call it a mental disorder. 1 in every 8. What's the world doing about it? If you talk about it, all the health ministries together in the whole world compile all their health budgets together. Only 2% of health budgets go to mental health globally. In some countries, it's far less than that. In fact, it's less than 1%. Some is 0.5% of their budgets goes into mental health. So can you imagine? But if you look at the whole world holistically, the ministry health budgets, only 2% of health budgets are devoted to mental health. So what are we doing? So it means that 98% are going into other conditions. And yet, as I said, 1 in every 8 person has a mental disorder. So are we doing enough? No way. And that's why WHO, that report is saying, the world is not doing enough to address the need. Mental health needs are high, but the response is very low. And the response is Medicaid. One, I'm talking about the health budget. Let's go to the health, human resource capacity for mental health. As we live now, if you look at all the mental health professionals is a big family which involves psychiatrists. These are specially trained people. There are other psychiatric nurses. I'm glad our colleagues are here. You have psychologists, you have social workers, you name them. Add all of them together. What the world is saying is that every 100,000 population, you only have 13 mental health professionals. to take care of them. Can you imagine? Let's look at this room now. 100,000 people in this room. 13 people are sitting here. They are going to attend to that 100,000. When will they finish? They will be exhausted. So this is telling you where we are. So it means that the human resource capacity for mental health is grossly inadequate. Grossly inadequate. 13 people per 100,000 population. This is serious. And where are we in terms of, services? In terms of services, nearly 50% of people with chronic mental health condition don't have, they don't have the service that they require. This is even serious in developing countries. Even in the developed countries, not all people with mental health condition have access to the service they require, to the service they need. So where are we now? When some programs they have a lot of funds, they have a lot. But again, because we are dealing with a complex phenomenon, please leave this room to say that with the notion that, with the concept, with the mindset that this is a big elephant. When you talk about mental health, it's beyond the psychiatric nurses, it's beyond the doctors, it's beyond our hospitals. They only see, as I always say, the head and the ear of the hippo. Hippopotamus is a huge animal. But when it is in water, you can hardly see the size of the hippo, because the leg, the stomach, all these things, they are inside water. You only see the head. So you will not be able to know how big that hippo is until that hippo comes out of the water, and then you see the real size of the hippo. Oh my God, this is a huge animal. So this is what mental health is all about. It's a huge animal. The animal is so big, so strong, so more powerful than the people who are supposed to be coordinating it. And this is the ministries of health all over the world. Mental health is bigger than the ministry of health. So therefore, because why? Mental health determinants are across different sectors. When we talk about this condition, we should be mindful about what are the risk factors for mental health. This is where you come in now. You don't only want to wait till, somebody goes to Tanga, for example, or a psychiatric hospital. That's not the time to be clapping, to be jumping here and there. We should start from knowing the risk factors. What do we do to promote mental health? You start with yourself as a family member, your own home. How do you promote mental health in your own home? Then we look for the risk factors. There are protective factors that we have in our society that we can use, that we can strengthen for the mental well-being of our people. What are these protective factors? This is what you should also think about. The protective factors are many. They are the ones that will keep us resilient. Because everybody, remember, mental health is a continuum. It doesn't mean that I am this and this. No, it's not bipolar. Two poles, no. It's a continuum. Meaning you can be at the highest level of mental well-being today, 2 weeks time, 1 month time, 1 year time, you can be at the lowest part of mental health continuum. So which means that nobody's vulnerable. Not everybody's vulnerable. Nobody's immune to mental health condition. So you can see yourself in that situation. We see ourselves in that mental health is a continuum. Somebody in Tanga today can be the best person tomorrow. You don't even can do far more than somebody who has never been to Tanga. Yet he was there before, but now he came back. See, when people have treated him or maybe whatever, that person comes out of Tanga being a very strong person, being more productive than even before. But these are the misconceptions surrounding mental health. People think when you are having this condition, you will never be all right again. Please, journalists, this is the wrong misconception about mental health. That's why think of it as a continuum. That you can be at Tanga one day, you can also be somewhere another day. Don't think that you are in people at Tanga, they are useless. We don't need that. Not knowing that it's a continuum, one day you may be there. Why should we be there? Because the risk factors are there waiting for you. What are the risk factors? The risk factors they can be behavioral. Do you drink alcohol? You see. Do you smoke? Those hard ones. Do you smoke? Do you use hard drugs? All those things are risk factors. Do we have dispute? Do we have war? How many wars are happening in this world? COVID-19 was very stressful for us in the whole world. How many of us were very much, they were so, they were so distressed in their homes. How many? So we can be talking about over and over, because this is just the opening. Only to tell you that we are happy that you are here. We hope we will do together, we work together. But the world is now on a transformative platform for mental health, meaning that we cannot do business as usual. Yes, we have to promote mental health. Yes, we have to protect mental health. Yes, we have to prevent mental health conditions. Yes, we have to provide services. Yes, we have to be leadership has to be strong. Yes, these financial resources must be there. Yes, we need to work together at the community level. A lot of conditions can be handled at community level, and that's the transformative mode that the world is going. It's not that we can have all our solutions solved at Tanka, no way. Even you yourself should be champions of mental health. This is the time now you should tighten your belts and say, let's go for mental health promotion. Where can we promote mental health? In our very homes, in our very institutions where you work, whether it's in the school. That's why mental health team wants to go to the schools. Because as we speak now, 13% of the adolescent population in the world, 13% has mental disorder. I mentioned it last time, sometime ago. And if you translate this into figures, 86 million people in this world, children between 10 and 14 years, 10 and 19 years, they have this mental health condition, 86 million. And when you go down, children with 10 to 14, another 18 million or so, they have this condition. But if you look at it statistically, 13% of our adolescents in the world, adolescents are less than 19 now. These are the people, these are the cream of our society. 13% of their population have mental disorder. Can it be? Where are we? So who is vulnerable? And when they have this condition when they are young, they are going to develop, in their adulthood, they are going to have this mental health condition. Right. So we need to promote. Promoting means let's work on the risk factors. The risk factors are many. Let's all work on the protective factors. Protective factors are our social relationship. Don't go in an office and you are isolating yourself. You don't talk to anyone. Be smiling. Be smiling. Let's help each other our problems. Sometimes I keep saying, we don't even know, our adolescents don't even know how to solve problems. When are we going to school to make sure children know how to solve problems? Problem solving skills are very important. Social interactions. Our mothers, our sisters are doing, Osusus are going on. They are very good platforms. But they are all disappearing. So these are the protective factors we have in our society. And I think it's important for you. That's why this, as I said, this press conference, don't come here to say, I'm just going to come and go. We want you to be champions for mental health. Now, as we close this meeting, you should have a library. Go to the library. The libraries are here. Our mental health experts are here. The libraries are here. WHO office is here. The libraries are here. Many websites are there. You can always do it. So thank you so much for coming, and God bless you.